Good morning, everyone. My name is Dr. Irina LaGrange, and on behalf of our student body and our staff, it is my pleasure to welcome you to Quince Orchard High School. At Quince Orchard, our core mission is to provide rigorous and engaging instruction in a safe, welcoming, and inclusive environment. But we also recognize that students' well-being is essential to their academic success. Teaching and learning cannot happen in isolation. As educators, we must be intentional in supporting the whole child. This is why our partnerships and resources in mental and behavioral health are so vital. Through expanded school-based mental health services, we're able to offer students and their families a coordinated system of support, ranging from individual, family, and group therapy to mentoring, youth development services, and development of healthy coping skills. We also provide services during the school day and through a variety of after-school activities and clubs and programs. These supports help ensure that every student can fully access the curriculum and thrive on their academic journey. We are grateful for the dedication of our Montgomery County Public Schools staff, as well as the strong partnerships with the Maryland Community Health Resources Commission, the Montgomery County Department of Health and Human Services, and many of our external partners. Together, they're delivering critical mental health and wellness services to not only the Quince Orchard cluster schools, but also to thousands of students and their families across our district. Thank you for being here this morning and for your continued commitment to mental health and well-being and success of all of our students. It is now my honor to introduce to you Ms. Grace Rivera-Oven, Vice President of the Montgomery County Board of Education.
Thank you so much, Irina, and I love the beautiful pen of the Cougars. The spirit is wonderful. I'm sure you all got greeted by the wonderful students of our school system. So I just want to say welcome to our friends from the different departments. Some of you have traveled from Baltimore and other areas, so welcome to the nice traffic in Montgomery County. And you were going against traffic, imagine that. I just want to say thank you so much to all our partners. I do have a written statement that I'm going to read in a second, but people who know me usually know that sometimes I have to say things from the heart. I just want to say that the funds that are being available for mental health are probably coming at the most important time. And I see Monica Martin from Health and Human Services. Monica and I have known each other for almost 30 years now. And we have worked in the mental health field. But ever since COVID, we have seen a decline in the mental health of our children. Heck, we have seen a decline among the adults who take care of our children in our schools. And with the environment that we're in, we're even seeing more anguish, anxiety, uncertainty, and depression among our young people. So I just want to say that we are so grateful for the support to be able to provide what our young people need these days and the support. So with that, now I'm going to read my written remarks. So good morning. Good morning, everyone. I'd like to begin by thanking Principal Irina LaGrange and her team for hosting us today and for their continued leadership in supporting our students and our families. You see and you feel the Cougar spirit throughout. Today's event is highlights the strong partnership that we have between Montgomery County Public Schools, the Maryland Community Health Resources Commission, the Montgomery County Department of Health and Human Services, and most importantly, the community partners who provide mental health and wellness services to all our students. These organizations are on the front lines in making a real difference here in our county every day. The Board of Education's core values, learning, respect, relationships, excellence, and equity, guide everything we do. These values remind us that student wellness is inseparable from academic success. Our vision is that all students will graduate and they will be future ready prepare to thrive in a changing world with the knowledge, skills, and confidence to lead, adapt, and make positive impact in their communities and beyond. In many of our communities, mental health is still a sensitive and an often taboo topic. I know that in my community, that is the case. So it is very important that we, as leaders, as educators, that we provide the support, the help, and the understanding required to let our students feel comfortable with sharing how they feel. We know that mental health and physical health are essential to our students' successes. When the students are healthy, when they are supported, especially emotionally, they are better able to grow, to learn, and to reach their full potential. I just want to say thank you to CHRC. I hate acronyms, so I'm going to say what it stands for. So that's Community Health Resource Center. I want to say thank you to them for the grant to our community partners so they can expand the vital behavioral health and wellness services that are going to be available to our students from pre-K through 12th grade. Pre-K through 12th grade. This investment made possible through the Blueprint for Maryland's Future. It strengthens us. It strengthens our shared commitment to building strong, healthy school communities, because caring for our students' health is caring for their education as well. So once again, I want to say thank you to all our partners, providers, and staff who make this important work possible together. We are helping every MCPS student become future ready. So thank you so much, folks. We truly appreciate it. And with that, it is my great pleasure to introduce the leader of MCPS. He really doesn't need much introduction. Make sure you see his TikTok videos. I'm looking forward to the ones this winter. And with that, I would like to introduce Dr. Thomas Taylor.
Well, I get the pleasure of introducing some student speakers, but before I do, I want to take a moment to reflect on this opportunity for partnership and teamwork. We can't do it by ourselves. That's just the reality. As a community, the school system can't do it by ourselves, and our partners can't do it by ourselves, and our parents can't do it by themselves either. It's a team sport, and as a team sport, we really do have to work and work well together. And so this opportunity for extending our partnership is all the more important. And candidly, as they say, it takes a village. This is an opportunity for us to celebrate the work of the village and to lift up the work of the village as we take care of the whole child and really embrace this. I gotta tell you, this experience will lead to serving over 6,000 of our students in MCPS. And though no funds directly go to MCPS as an entity, we recognize the value in teamwork in our partners. And I think it's important to hit on one more critical part of this equation, which is the return on investment that our community gets from this type of partnership in our work together to lift up mental health. This has one of the highest consumer satisfaction rates of anything that we do in the state of Maryland. Over 90% of those who are being served and their families recognize the benefit that comes from this work and this partnership. Amazing. And we actually see tangible improvements in student behavior and mental well-being. As a result of this, over 85% of our students that are served see a marked improvement in outcomes. That's phenomenal. So our embracing of this continued partnership, our embracing of this work really is making a huge difference in Montgomery County and in the state of Maryland. So to that end, I also want to echo one more additional thanks, and I'm not going to be redundant. Senator Kagan, thank you so much for leading this work on behalf of this corner of Gaithersburg and Maryland. We appreciate your support, and we appreciate your coordination in helping us in the State House in Annapolis. So now for the good part, I get to introduce a few students to share some comments and remarks on this important occasion. Maria, Pamela, and Paula, if you guys want to come up. You guys are up, and you're going to do the introduction. Very good. Even better yet. Thank you so much.
I'm just going to give a short introduction to our students, and then I'll speak a little bit later about our programs here. So I'm Carolyn Camacho with Identity, and it's a great pleasure to be here. And we want to extend our thanks to the Maryland CHRC for supporting us with the funding to be able to deliver programs that build self-healing communities here in MCPS. As part of the CHRC grant, Identity is implementing some Tier 2 programs in schools, including Quince Orchard. And this program is called Encuentros, which means coming together. And it's a non-clinical emotional support group for high school age students. And we also have a virtual version for adults. But this morning, I'd like to give Paula Gomez and Maria Fernanda Ruedas the opportunity to speak about the impact of the Encuentros program on them. So as part of the Encuentros program, students who participate in the group and who really feel connected decide to receive training and go on to be youth peer leaders. And I'm going to share a secret with you, is that the youth peer leaders are the secret to the success of this program, which is just growing amazing in places like Quince Orchard. So I want to give Paula and Maria Fernanda the opportunity to just share a few words about the impact that the program had on them and also about their role as youth peer leaders. Paula, you want to speak first?
Good morning. I'm Paula Gomez. I'm actually a junior here at Quince Orchard. I wanted to give thanks for this opportunity that I've been given to be here this morning. I wanted to say that my freshman year starting at QO was really hard, mostly on my mental health, because coming into a new environment from middle school really did affect me, like physically, mentally. I didn't know what I was getting myself into coming into here, getting into this environment. I found out there was these groups that were giving a space to students where they can speak about issues that teenagers, all these kids, don't really have a place to go and talk to, where like these emotions that we were given when we're here, it's something that is not really talked about. But these groups gave me and many other students an opportunity to talk about that and get to notice and other students that are going through the same thing, are feeling the same way that you're feeling in high school. I learned that being a peer leader here has really helped me like grow myself mentally. It has really helped me in my years of high school, and I feel like this program has really helped other students as well, and it actually helped my family because they also participated in this. So it like has helped me, my family, and many other students. So I just want to give thanks for that. Thank you.
Good morning, everyone. My name is Maria Fernanda Rueda. I'm gonna say a part in Spanish because I feel comfortable, and then Caroline will translate for me. Yo empecé en Encuentros hace 2 años y fue una oportunidad muy grande y muy bonita para mí, en la cual pude ayudar a otras personas y aprender mucho sobre la salud mental. And
So Maria Fernanda is 2 years ago participated in the Encuentros program and has felt that as youth peer leader, being a youth peer leader has really helped benefited her, as well as allowed her to help provide support to her peers.
Al inicio empecé tomando las reuniones, las sesiones, que me parece que tienen un contenido muy importante, y después tuve la oportunidad de ser Youth Peer Leader, de la cual estoy muy feliz y agradecida con Identity por darme esta oportunidad.
Okay, so when she first participated, the sessions provided content that was very beneficial to her. And then now, as youth peer leader, she's very grateful to have this opportunity, again, to support her peers.
And I just want to say Encuentros is like a safe place for me, and I love everyone with this participation.
Thank you very much. And perhaps at some point, if you all have questions, I'm sure Paula and Maria Fernanda would be happy to answer them. Thank you.
Thank you. It is my pleasure now to introduce to you David Rudolph, Chair, Maryland Consortium of Coordinated Community Supports.
Good morning, folks. I really don't have to say anything because it's already been said. The Vice Chairman of the Board of Education, you can have it written down really pretty. It was well said, and it was from your heart, and that meant a great deal. I mean, you're a wonderful speaker, and the students, you've done a great job saying some nice words, and it is a pleasure for me, who happens to live in Cecil County, and in Annapolis. I served in Annapolis for 20 years, and I had the opportunity to tell many legislators where Cecil County is. I'm not going to ask you because you are all intelligent people and great geography masters, but Cecil County happens to be, for me, I left this morning before the sun rose. So you know how far I had to drive to get here. But my staff said there is going to be a lot of smart people there, and we need to bring out the top guns. So they brought me out, which I don't know, top gun, and the chairman of our health commission, and so we're here to award a lot of money. But we're awarding $9 million because 7 groups.
9.36 million.
Wrote excellent grants. You don't get the money because you happen to smile or happen to represent a school district that's large. You have groups in this county who care about kids and wrote some serious grants. And that's how the grants got funded. $9 million to serve Montgomery County. Understand? And it truly will have an effect on the Vice Chairman of the Board of Education's thoughts in regards to your students. I believe that we're going to make an impact. I'll say a couple words in regards to my role as chairman. I do have a lot of friends in Annapolis, and sometimes that's good and sometimes that's bad. It happened that I got a phone call from the speaker's office, come down to speak with the speaker. She had an opportunity for me. And you don't know what an opportunity is that something you don't want to do because you're going to be stuck doing it unless you really want to do it. And when that was said to me in regards to having the chance to chair the consortium, which are 25 people from throughout the state who dedicate their time and efforts. Gail's here. Larry is hiding someplace. Dr. Where are you, Larry? Oh, right there. And up 25 of us met 3 years ago, almost 4 years ago, and designed a program that will work throughout the state of Maryland. It was in response to an amendment put into the blueprint for education because the state of Maryland legislators realize the importance of doing something about the mental health of our students. I was a school principal for 26 years, so I understand the school bells. But so the first year we had to design something that's going to work statewide, because what's the issues you're facing here in Montgomery County may not be what is important to folks on the Eastern Shore or the western part of the state. So we had to come up with a plan that at the end of the day, we will have a statewide program addressing thousands of kids. And we're on our way. And whether or not last year we did 130-some thousand students in the state of Maryland. This year, hopefully, that'll be much higher. But it is a privilege for me to work with such intelligent people who care about kids. You don't have that often, that somebody's not in there complaining about something. This group is dedicated to the future of Maryland and the mental health of our kids. And I would, before I finish, I have to say one thing. Cheryl Kagan, where are Cheryl? Cheryl and I served together in the Maryland House of Delegates. I didn't realize, truthfully, when I left the House this morning, how far I was driving. I had no idea. I said, someone told me it's the other side of Baltimore. I said, oh, okay, I was all right with that. Well, the other side of Baltimore is a pretty big location. And Cheryl and I talked a lot. Takes me a couple hours to get home from Annapolis, but sometimes it takes her a couple hours to get home from Annapolis as well because of the traffic. But this morning was a very interesting drive. And I hope that the drive back home will not take the same amount of time because I have another meeting late this afternoon. So I just want you to know you're sitting here with a group of people who care about kids, from the superintendent to the Board of Education, the principal, and students. They care about students' welfare. And with this $9 million that you're going to get in additional money, I believe very strongly at the end of the day, Montgomery County will be proud that they were participants in this grant and in this program. Thank you very much. It's been my pleasure. I now would like to introduce the new chair. Chair. The consortium is this. All right, above the consortium is the commission. And the commission, we approve the grants. Like last year, we approved 90 grants. Am I right? Okay. Don't quibble. And we awarded 100 million. All right. So we had to have a lot of people read those grants. All right. And then after they get read and we recognize the ones we want to fund, we send the packet up to the commission. And commission and chair of the commission, Ramjan, has been an excellent leader of the commission and has done a great job. And it's my pleasure to work with her and also to introduce her. Chair Ramjan.
Thank you so much. I think Chair Rudolph nailed it when he articulated the sort of drive in waking up before dawn to get here, because the undercurrent of the work that he leads, the undercurrent of the work of the Community Health Resources Commission is commitment and dedication to Maryland students, to Maryland's families, and ensuring wellness thrives. And so I'm so proud to get to work with him each day. And as you noted, Chair Rudolph, I do think that Superintendent Taylor kind of stole all of our talking points in the best way, because some of the other themes about what our superintendent blessed us with this morning are those components around working together. There's an old adage that says, if you want to go fast, go alone, and if you want to go far, go together. And the work of this consortium and the commission as the fiscal agent helps to ensure we can go faster, farther together. So as was mentioned, I am Dr. Destiny Simone Ramjan. I'm a public health sociologist by trade, and we know all about the ways in which social drivers impacts community health outcomes. And so it's why I am so thrilled to serve as chair of the Community Health Resources Commission. I was appointed by Governor Wes Moore this June, and I'm really excited to be here. Principal LaGrange, the students and the Cougars were so brilliant this morning, and I understand there was a
pretty famous person on Sunday afternoon in Madrid, an alum of this university, playing in against the Commanders. Do we not know Chop Robinson here, Dolphins? No? All right, well, someone does because he represented you quite well abroad. So I want to tell you a little bit about the Community Health Resources Commission. We were created by the Maryland General Assembly in 2005 to expand access to health care in underserved communities. In the past 2 decades, we have earned a reputation for partnership, innovation, and measurable impact. Let me quantify that for you. Since 2005, the Commission has awarded 985 grants, serving almost 1 million Marylanders, totaling about $396 million. That's something worth celebrating. And it's worth celebrating because none of this would be possible without the leadership of the Maryland General Assembly. Let me first acknowledge our phenomenal Senate Education, Energy, and Environment Committee Vice Chair, Cheryl Kagan. Thank you so much for fighting for us in Annapolis and beyond. We're grateful to your unwavering commitment. So what we're celebrating today, as you've heard from the speakers before me, are one of the Commission's core initiatives, the consortium. When the General Assembly called on the Commission to serve as the fiscal agent, we did so with great responsibility and with great care. We ensure that each dollar is invested with purpose, building systems of care grounded in connection, compassion, and in measurable outcomes for Maryland's children and families. The CHRC, as its fiscal agent, provides oversight so that every initiative aligns with state priorities, community needs, and evidence-based practices. I want to zoom out because you've heard the term $9 million, right, for Montgomery County. The Community Health Resources Commission, via the consortium, has actually made investments in every single state and in every single jurisdiction in the state, totaling a whopping $97 million this past June. Again, I think that's where I see a lot of heads nodding. That's a lot of money. But it's not just a lot of investment via dollars. It's an investment of time to ensure that we are addressing the behavioral health needs of our students. Teachers see it in classrooms, parents see it at home, and our job is to ensure that when a child reaches for help, there is someone there, whether it's a counselor, a behavioral health partner, or a trusted community specialist, to ensure that the hub and spoke model is connecting schools, behavioral health providers, and community organizations to form a network of care. So as was mentioned, right here in Montgomery County, over 6,000 students served. We're operating in 82% of Montgomery County Public Schools, and our partners, like the Parent Encouragement Program and the Jewish Social Service Agency, are building capacity, not just in delivery of services, but in the who gets to deliver it, with over 88 new behavioral workforce members hired as a result of this grant making alone. So, thank you. Behind every policy and every grant is the hardest working staff in showbiz. I want to acknowledge our fantastic Executive Director, Mark Luckner. We also have Megan Brown. The CHRC staff reads line by line every one of those awards and ensures that we're continuing to make impact. So thank you for also being here, Councilmember Jawando and Councilmember Sales. We appreciate you, and together we're building a Maryland where every student can learn, grow, and thrive in body and in mind. Thank you. With that, I'm going to call to the stage Commissioner Townsend to share some remarks on her hometown.
Wow. Good morning, everyone. What a fabulous welcome we all had today. I was so impressed. Balloons, mascot, greeters. I was like, please come in from the cold. And then I remembered, well, I have a 12-year-old and she still thinks it's short weather. So I guess I'm just, I'm not with the times here, evidently. Good morning, everyone. I am Crystal Townsend, and I have lived and worked in Montgomery County for over 25 years. And most recently, I was the past president and CEO of the Healthcare Initiative Foundation, which profoundly invested for over I think, the last 15 years in groups like Identity and JESSA and Shepherd Pratt. So we're so pleased to see these initiatives scale and grow. It's an honor to be here to witness such great collaboration. I'm so grateful to Governor Moore for appointing me to the CHRC Commission earlier this year. I have so long respected the work and the systemic collaboration that happens to the approach of bringing health equity across our state. CRG is so pleased to address the student mental health, and I just want to share and thank Chair Ramjan, who showed the incredibly proud work and impact that we've made through our grant programming. You've heard over and over again throughout the state, we've invested $97 million in the last year. In Montgomery County, $9 million, serving over 6,000 residents. But as was mentioned earlier, this is compounded because impact isn't just with the students, it's with the ecosystem, it's with the parents, it's with the teachers, it's what everybody's being trained for, and it's also building our workforce. So I look forward to later on hearing some more about these great programs, and I can't wait to go see Jessa's Minecraft mobile unit outside. I bet everybody got to see a quick preview earlier. And I just want to also just kind of lay the groundwork. You know, I like the saying, many hands make light work. And this is truly an endeavor that has taken a time of planting seeds to get there. And now we're beginning our third year preparations for the consortium grants. Our commission is meeting next month to begin to discuss the next round of funding and opportunities, and we'll be releasing these opportunities shortly after. But I also want to thank, and we have Sarah who is in here today, Montgomery County's local behavioral health authority will be serving as your central hub. It's a coordinating at local service providers to compile a comprehensive and unified proposal to the submission to the CHRC. The Montgomery County LBHA has been working closely with the consortium and CRG staff to prepare for this step. They've been working on developing a landscape assessment and asset mapping so we can best deploy our public resources to our students and families in a coordinated way. We are excited that the Montgomery County LBHA is taking on this responsibility as will lead to improved service, coordination, and program development. Thank you, Sarah, for your team. I would also like to thank Montgomery County Department of Health and Human Services, and we have Monica Martin here, for their leadership in working through the local procurement process issues to enable the Montgomery County LBHA to submit an omnibus proposal this next year to the CHRC. As you all know, these tasks that go behind the scenes are what makes the work really happen. And so we thank everybody that's a part of our journey to making sure, little unsung heroes, as you will. In a few moments, you will hear from other service providers who are providing services in Montgomery County under this initiative. But now, it's my honor to introduce my friend and the nonprofit senator. Sorry, I have to say that. She's a true champion. Senator Cheryl Kagan, who's Vice Chair of Education, Energy, and Environment Committee. Thank you, Cheryl.
Good morning. So people have said nice things about me, so I feel like I've got nowhere to go but downhill from here. Dr. Taylor, I need your dispensation here. I'm a very proud Churchill Bulldog. I don't know about standing in front of this Cougars banner here, but my loyalties are a little split. So I'm Cheryl Kagan, very proud to be the senator for Gaithersburg and Rockville, and I am thrilled to be here on behalf of the entire Montgomery County delegation. So there are 34 of us, senators and delegates, who work really hard to represent you all and what's right for Montgomery County Public Schools and our students. Before I go on, I gotta give a shout out. He's not even paying attention, damn it. My friend and former colleague, Dave Rudolph. It's amazing that you came down from Cecil County, which is a long darn way. So thank you for coming to District 17 and being with us today, and for your leadership. when we passed the blueprint for Maryland's future, it was a 10-year plan. Former governor, and this is me being a little political here, former Governor Larry Hogan vetoed it, so we had to come back. But it was a 10-year plan, and it got national attention. It was so thoughtful. It was headed by former Montgomery, Maryland Chancellor Britt Kerwin, and had super smart people on the commission that led to the legislative recommendations. And yes, it included buildings and computers and faculty and staff and so many aspects, but it also included funding for more mental health. A student who is worried about housing, a student who is worried about food, a student who is worried about their immigration status and whether ICE is going to come and capture and arrest and take away their family members, is not a student who's ready to learn. And that's the importance of this program and these grants. They need our support, they need mental health care, they need access to caring people who will listen and offer coaching. This will make a difference not just today, but help them on their trajectory for toda la vida, totally their whole life, and hopefully they will continue to be aware, not worried about. I think it was Gracie who talked about removing the stigma from mental health care. We all have hard times. And when you're a teenager, the times are just, especially now, post-COVID and in these crazy, crazy times, we really need to take care of our young people. And this is what this program, these grants will allow. I want to acknowledge the partners. So Crystal Carr-Townsend talked about many of the government partners. I also want to give a shout out to our nonprofit partners, not just Jessa, but Caring Matters, on whose board I serve, and when there is a loss in the family, a death, an illness, they are present, and so many others. Identity, which does great work, thank you, in the community to be welcoming and building our future leaders. In closing, 3 people have died in my district when 911 has failed, and we've been working on improving our 911 systems. Too many people are still unaware of 988, and no one has spoken about 988 yet. And so we have to put that out there all the time, everywhere. I would love to have passed signs in this building that will talk about 988. It is the free 24/7, 365 suicide and mental health crisis hotline, because not everyone will have access to a social worker, a therapist, a mentor, a counselor. And yet that's available to you. And so Every Mind and so many other partners are available through 988. So that's I want to remind everyone of that. Thank you to every single person who has listened to lots of speeches on this morning. And so thank you for what you do every day. Thank you for being here. Thank you for allowing me to say a few words. Appreciate you all.
Thank you so much, Senator Kagan. I did want to tell you that the number is published on the back, and a sticker on every single Chromebook for every single Montgomery County student in Spanish and English. So I did want to tell you that. And Dr. Ramjohn, where did she go? I want to tell you, Chop Robinson is in fact a CUO graduate. Yes, he is. We watched him yesterday. And this summer, he actually flew in here from Miami to work with younger children. So he's very committed to giving back to Montgomery County and specifically to our cluster. And he came here with hundreds of kids who came out and he spoke to them and worked out with them with our football team. And he's an incredible guy. So yes, we watched him and supported him. Thank you for sharing that. It is my pleasure now to introduce to you Monica Martin, who's a chief at the Behavioral Health and Crisis Services for Montgomery County Department of Health and Human Services. Welcome.
I I'm the one who always adjusts the microphone down. So, good morning, everybody. Thank you so much for those critical updates, Principal LaGrange. And thank you, Senator Kagan, for not just championing all of this, but for that 988 shout out. Thank you so much. It's so important. So I'm going to be brief. I know we're running short on time. I don't want to repeat anything that's already been shared. So suffice it to say, I love all of you. You're all critical to this work. Thank you so much. It's an honor to be here today as the Chief of Behavioral Health and Crisis Services in the Department of Health and Human Services. I bring greetings on behalf of our director, Dr. James C. Bridgers, and our county executive, who uplift and affirm this work and support it in any way possible, absolutely. I also, again, everything has been said, and especially, these two young ladies in front of me right now. I just have to lift up what they've already said and shared. Señoritas, gracias por su voluntad y su liderazgo. To be able to be vulnerable and willing and be up here in front of all of us today, to share not only that they recognize in themselves a need to participate in this kind of service, that they stepped up to do it, and then what they gained from it, what their families gained from it, and then to take another step further, to start becoming leaders in this work, is exactly what we need. So we need more of you. Thank you so much. This is what this is all about, breaking down stigma. So we really appreciate you being here today and speaking. As the Chief of Behavioral Health and Crisis Services, I have the privilege of overseeing a myriad of efforts to provide equitable behavioral health services to all of our county residents, but this particular effort runs kind of deeper for me. It hits home in a lot of ways. For those of you that know me, and I know many of you here, a lot of old friends here, some new friends here, what you may not know is that my first clinical internship as a clinician was on a high school campus, and I was hooked. And so I've spent most of my career here in Montgomery County building and sustaining school-based and linked partnerships for mental health, and for family supports and community supports. So this is right up my alley. Montgomery County, we have a deep and rich history of embedding mental health services in schools. It's over 30 years strong, but this opportunity just puts it on steroids, and it's so exciting to have the Department of Health and Human Services now stepping into a full community supports partnership hub role to really just expand on that and grow the work, again, with the help of our youth leaders. We're counting on you. Thank you so much. So again, thanks to the Community Health Resources grant and the vision of the Maryland General Assembly through the Blueprint for Maryland's Future. This is not just about services, as we've heard. It's about providing hope, healing, and a pathway for wellness. Again, I know firsthand the power of these collaborations and the difference they make in the lives of students and families, but also, as one of my predecessors up here talking said, to teachers and to whole school communities ultimately. So I'm excited to re-recognize the director of our local behavioral health authority, Sarah Rose, for her work in transitioning this partnership into a full community supports hub, but also Sean Latanzio, who some of you may know, but many of you may not know. She's our child and adolescent coordinator in the local behavioral health authority and has been serving as the acting hub manager this whole time for the last year and a half, 2 years almost, right? Year and a half. And that was, in addition to her already many full-time responsibilities. So thank you, Sean. I'm excited to also introduce our providers and sharing the work that they do. They are the ones that are really making the magic happen at the schools. So I'm not going to stand in the way of you and them, other than to also acknowledge all of our elected county council members and Board of Education members for, again, the rich history of providing support for this kind of work in Montgomery County and for supporting it moving forward through the investment of the state and the Community Health Resources Commission. So without further ado, I am introducing Jilly Cannon, Senior Director of Children's Bereavement Services at Caring Matters. There you are, Jilly.
Thank you, Monica, for adjusting the microphone for me, so I didn't have to do it. Good morning. My name is Jilly Cannon, and I'm the Senior Director of Children's Bereavement Services at Caring Matters. Caring Matters is a small non-profit based in Gaithersburg, Maryland, supporting Montgomery County residents who are living with serious illness, dying, or grieving, so that no one dies or grieves alone. All our direct services are offered free of charge. I just want to give a shout out to Cheryl Kagan for all your support of our organisation, as well as everything that you do for Montgomery County. Children and teens are often called the forgotten mourners because the adults in their lives are also grieving their grief, and it's often overwhelming. Their children often look fine, even though internally their grief is as deep and wide as the adult caregivers. In fact, 1 in 11 students in Maryland will be grieving the death of a parent or sibling before they graduate from high school. This statistic doesn't include children grieving the death of a grandparent, a relative, friends, or other important people in their lives. The truth is, we adults are not very good at talking about death and grief, and that silence often leaves children grieving alone. Grief is messy and unpredictable. It doesn't only show up when children are at home. Given the amount of time that children spend in school, it's essential for school systems to be grief aware and willing and able to be supportive of grieving children during the school day. Research has shown that peer grief support groups are one of the most impactful ways we can support grieving students. Offering our peer support groups, our Good Grief Clubs in MCPS at no charge during the day removes barriers to access and allows students to grieve in their school community with other grieving peers. We are so grateful for our long partnership with MCPS that allows us to facilitate our Good Grief Clubs in schools K through 12. Not every school district around the country has understood the positive impact that these groups can have on grieving students' ability to function, concentrate in school, and learn in the classroom, and why grief support during the school day can be so life-changing. On behalf of all of us at Caring Matters and bereaved children in Montgomery County, thank you so much for the grant we have received from the CHRC. This grant has partially funded our Good Grief Club program for 2 years in a row. It's greatly enhanced our ability to provide and expand our Good Grief Club program to any grieving student so that no child grieves alone or is forgotten. In the words of one of our high school participants, the Good Grief Club has helped me so much by showing me that I'm not alone in school. I've formed new friendships. I've learned how to cope. I've learned that grieving is okay. I used to hide or lock away my emotions, but now I can fully express myself. Thank you.
Thank you so much. Please join me in welcoming Carolyn Camacho, Program Director of Identity.
Thank you very much. And again, it's a pleasure to be here, and want to express our gratitude to the CHRC for supporting the programs that we're able to provide here at Quince Orchard and in other school communities. And as I mentioned earlier, our project is really to focus on contributing to building self-healing communities in MCPS. And we seek to do that by increasing the skills of our students, of our school staff, and our parents and guardians to take care of their own mental and emotional well-being, to be able to manage difficult emotions, and also provide support to their families and to their peers. And so what this looks like, and the CHRC funded programs are, we offer Tier 1 programs, including the Botvin Life Skills, which is a priority evidence-based program that helps young people build healthy decision-making skills and has been shown to reduce the likelihood of young people engaging in substance misuse. We also offer presentations. Identity staff has been trained to deliver the ACE interface presentation, and we seek to do this widely, both to staff, school staff, but also parents and guardians. So to raise awareness about the impact that adverse childhood experiences has on the development, the physical and emotional development of young people. And we've been successful at that. And our Tier 2 program, the Encuentros program that we mentioned earlier, that we're offering both for high school students and also for adults, the virtual version. And as Paula and Maria Fernanda shared, with the Encuentros program, we're creating a safe space in the school where young people can share about difficult situations and share some of their coping strategies, and also learn from each other and be able to build the skills and for facing those situations that we know that will come their way as they grow. So as I mentioned, and hopefully we'll have a chance to hear a little bit more from Paula and Maria Fernanda, the key to the success of the Encuentros program has been our young people, our youth peer leaders that find a safe space for themselves, and then they just don't want to keep it inside, but they want to share it with their peers, and that's really been the engine to the success, to the growth and success of this program. And so thanks to the CHRC, and I'm happy to pass the baton to Kathy Hedge, the Executive Director of PEP, another fabulous partner here in the community.
Good morning. I'm Kathy Hedge. I'm the Executive Director of the Parent Encouragement Program, better known as PEP. For over 40 years, our mission has been to help children become confident, emotionally resilient, and successful in school by supporting the people who shape their lives the most, and that's their parents and their caregivers. Our flagship initiative, which has been funded by the CHRC here in Montgomery County and in other parts of the state, is the PEP Family Resiliency Program. It's an 8-week small group experience for parents and caregivers. Participants meet once a week, online or in person, in English, Spanish, or Amharic, and each week they learn a practical tool. Perhaps it's about communicating with their kids or managing emotions or setting limits. And then they talk together about how to apply those tools in their home environment. Our facilitators are local parents who previously took the program and then received further training from PEP. What this has created is a peer-based model, which is rooted in trust and shared lived experience. And it's a collaborative space where parents can learn with and from each other, which really builds their sense of empowerment, so that they really walk away feeling like not only they learned something, but they gave something back to each other. Last year, over 1,300 parents and caregivers here in Montgomery County participated in the program, representing over 2,500 children in 190 MCPS schools, mostly in community schools, which, as we know, are in communities with high levels of poverty. Now, we at PEP have been doing this work for a long time, and we wanted to get a sense of really what our outcomes were and have a measure for that in a more tangible way. So about 3 years ago, we started partnering with NORC at the University of Chicago, and they created for us a research-validated instrument to measure our outcomes. So let me share with you a little bit about what those measurements told us in our work here in Montgomery County last year. First of all, 98% of participants who completed the program stated that they had an improved relationship with their child or children. Now, NORC also measures how much change was achieved, and they found large positive change in all of the 8 outcome areas. So, for example, parents reported that their relationship with their child improved by 29%. They reported that their communications with their children improved by 23%. Parents reported a 22% increase in children showing responsibility for their schoolwork, which I know as a parent is always top of mind. And 87% of participants said that the program made them feel more closely connected to their school. Now, the numbers are powerful, but the stories behind them really bring that to life. Parents tell us that they're more patient, they listen to their children more, and they're better able to manage their children's stress and their own stress. Many say the sessions feel almost like therapy, and it helps them manage their own anger and helps them bring more sense of unity and calm in the home. And almost all the parents come back and say, this program helped me feel that I am not alone. So as we think about how to invest our limited resources in our communities, I would just say it's really important not to lose sight of parents and caregivers. They can be hard to reach and sometimes hard to engage, but they are absolutely central to a child's life and to that child's outcomes. And when we invest in our parents and our caregivers, we invest in every child in that family every single day. So thank you very much to the CRC and to all of you for the work you're all supporting and doing in our community. Thank you.
Thank you so much. Please join me in welcoming Joseph Wilson, Senior Director of Mental Health for Jewish Social Services Agency.
Thank you. I know we're short on time. I'll keep it brief. Jess is really excited to be part of this group of amazing providers and partners in providing services and access to services to students. Since 2020, we've been partnering with MCPS to build a service delivery system that is really rooted in three things: rapid access, sustained engagement, and hopefully better outcomes. And our wonderful partners, Dr. Chester and Farah Jones, have been wonderful in supporting our work. And last year we were able to be a CHRC recipient, and I want to say thank you to Senator Kagan, who I know believes that when nonprofits have more, they can do more. And what we absolutely need to do is more for the students in the county. Last year, JESSA received over 1,300 referrals for services across all three tiers, Tier 1, Tier 2, and Tier 3. We served 1,100 students, training 312 students in teen mental health first aid, which is an evidence-based practice designed to help students feel more comfortable reaching out to a trusted adult or to one another to recognize and talk about mental health concerns. Our Tier 2 services support students and families in connecting to services and supports in the community. And our Tier 3 is our mental health in adolescent and child outpatient services, individual, family, and group therapy. Altogether, they represent an amazing continuum of care that we provided across 79 schools. We're looking forward to doing more this year and are grateful to CHRC for their support. And I will say, in addition to just services, the most important is having the collaborative infrastructure and the partnership. And so we wouldn't certainly be able to do this work without the partners in MCPS, LBHA, DHHS. We've been able to leverage 80% funding match for all the CHRC funding. So last year, for every dollar CHRC gave JESSA, we matched it with 80 cents. In other funding, whether that's Medicaid funding, private foundations and philanthropy, local contracts, and so we look forward to doing more and highlighting how we can build partnerships. I will say, I saw Councilmember Albernaz here. We're looking forward to bringing back the SCUP conference, if you remember, because most important partners at the school level are teachers, counselors, the school-based staff who do the hard work of trying to connect students to services. We absolutely need a time and some space, so I'll ask anyone here who's got a large enough space to host that conference. We'd love to have it next fall, and we're going to be asking CHRC to support us in that as well. Over 500 professionals across the system come to that conference, although it hasn't happened for a while, but we're hoping to get it started again so we can really help support and educate our partners at the ground level to join us in this important work. So thank you very much to CHRC and for all of our elected officials for supporting the work. Thank you.
Thank you so much. I do want to make sure that we recognize and welcome Laura Stewart, who's also one of the members of the Board of Education and is most supportive. Thank you for joining us this morning. We also with us have this morning a dear friend, Councilmember Lorianne Sales. I'm so glad she's here today, as well as Councilmember Gabe Alvarez. Thank you so much for joining us. So at this time, please welcome Will Jawando, Councilmember, County Vice President and Chair of the Education and Culture Committee.
Good morning. I'm the last speaker, don't worry. My colleagues are joining me, Councilmember Sales, who's at-large member, and Councilmember Albernaz, who's at-large member. He is in his last week or 2 weeks as a council member, and my good friend. He's also a member of the Education and Culture Committee and chair of the Health and Human Services Committee. I want to thank Dr. Taylor, Senator Kagan, Laura Stewart, Grace Rivera-Oven, all of the folks in this room. This is like the long press conference because it takes a lot to make sure our kids are okay. The whole time I was thinking about, what was I going to say? I'm at the end, and now I know exactly what to say because Councilmember Albernaz and I talked about this, and Dr. Taylor and I have talked about this. Post-COVID and during COVID, we invested a ton of money in school-based mental health resources. And we knew the cliff was coming. And so there was a discussion, okay, what are we gonna do? Because we know the kids before COVID needed help, but particularly after COVID, it was just exacerbated. And there were discussions during budget time of where should services be housed and how much can we continue to provide and afford. And I've always advocated, and I think this room proves, the collaboration between nonprofits, the state, the local level, that it doesn't matter, we just have to provide the resources. HHS providing them, we have the great braided partnership where they're providing a lot of services in the schools through our wellness centers and counselors. MCPS has staff on staff. I've got 4 kids, MCPS kids. My youngest didn't want to go to school today, had a breakdown, had to go through breathing exercises that I learned from the counselors at MCPS, and who walked him in today. He's a first grader. There's a tiered level of support that you've heard described today that is helping our kids at every level. And the sad news, but the happy news today is that it's not enough. We need more. You heard from our 2 amazing students, the challenges that they're facing and their bravery in sharing. And I just want to push us, and I want you to know that on the council, we know that we can't roll back these services. And whether it's an HHS, a state grant, MCPS funding, our kids are crying out for help. They need it. And there's a lot of ways to provide it. And I'm just really proud that we're in a county that recognizes that and a state that recognizes that, with the folks serving at the state level as well. And we're going to keep it up because we know, as was mentioned, our kids learn and are full, healthy, happy people when they have the support and the wraparound support. So we're going to keep doing it, and I want to thank everyone for being here. Councilmember Sayles she's going to be the last speaker, so not me. And then we'll sign the big check. I just want to end by saying thank you to Councilmember Albanaz publicly. This might be one of his last press conferences as a council member. It's been an honor to serve with him. This issue is one of the many that he's cared about. He's going to go back home and be the director of the Recreation Department and be in this room helping with this stuff as well, because they play a big role. So let's just give him a round of applause. Councilmember Sayles.
So good morning, everyone. I am Councilmember at Large Lorianne Sayles, the lead for eliminating disparities in public health. And it's so great to be here back in the city of Gaithersburg to talk about awarding this grant to this community. And it's great to see Dr. LaGrange here. She was my daughter's middle school principal, so she has varied experience in dealing with our students at many levels. And I was just listening to a recent article during the news last week about the infiltration of AI and how our students are now relying on these artificial relationships because they do not have a trusted adult to speak with. And so thinking about having the 988 number on the backs of our iPads and the instruments that our students use to connect to the internet, that they have a readily accessible pipeline to get the help that they need is so critically important. And so as we're thinking about eliminating these disparities and creating more pathways to ensure our students have trusted adults, they can now text the different numbers to ensure that we're meeting them wherever they are. It's so heartwarming to have so many partners at the state, the county, across this room in our nonprofits. And I'm so grateful that my colleague, the chair of Health and Human Services, is going to be leading the Department of Recreation because out of school time is so critically important. We'll be talking about that at the council this week. And so I'm grateful to be here, grateful to the chair of the Education and Culture Committee and our vice president for also standing in support and in partnership to ensure that MCPS students, parents, and our community have the resources they need to thrive. Thank you.
Thank you so much. At this time, this is the exciting part. We're going to present the ceremonial check. If we could have Mr. Rudolph and Dr. Ramjohn come up, please, and join us for this. Thank you. Thank you so much for joining us again. Thank you.